Hello everyone. Today we're going to talk about rooming the patient. My name is Shellie Sulzberger. I'm from Kansas City. I'm a nurse by background as well as a certified professional coder and an ICD-10 trainer. I work with health centers like yours all over the country, helping them with coding, documentation, compliance, etc. So there's nothing legal in the presentation. So when you think about rooming the patient, everybody thinks that's a really easy job. It's not. It's a hard job. So when you start, the very first part of rooming the patient is calling that patient from the waiting room. One of the key things is I see people not introducing themselves to the patient. A lot of times you think the patient remembers your name or knows you, but it's a great habit just to get in. Good morning, Mrs. Jones. My name is Shellie. I'm working with Dr. So-and-so today. I'm the nurse, I'm the medical assistant, whatever your credentials are. Always introduce yourself, use their name, and always smile. Then you move on and you're going to take your vital signs and any other pertinent information. When you get the patient in the room, you're actually going to start talking about why they're here. So you might ask, what's the main goal for your visit today? You might say, it looks like you're here to follow up on your diabetes. Is there anything else you'd like to have covered? You want to try to obtain as much key information. So think about, if you were the patient, what questions would the provider ask you? So for example, if a patient's coming in and they've got a cough, your providers are going to want to know, when did the cough start? Are you coughing anything up? If they are, what color is it? Is it yellow? Is it white? Have you been running a fever? What other symptoms are you having? Have you tried any over-the-counter cough syrup, etc.? So your goal is to start asking those questions that maybe the provider would ask you if you were the patient. When a patient tells you they need refills, well, that is not very explicit. We need to know what they need refills for. So for example, I need refills for my insulin and Vyvanse. That tells you that they're here to follow up on their diabetes and ADHD. So when you document, you're going to document that the patient is here for ADHD and diabetes. So other things that you will be doing when you room the patient, depending on your health center. You may be going through the past medical history, family history, social history, allergies, adverse reactions, when was their last pap smear, mammogram, etc., if that was not identified during the pre-visit planning. Now, when you think about social history, sometimes what I hear clinical staff say to patients is everything the same. The patients have no idea what you have in your record. So for example, it may say that I'm an everyday smoker, but Dr. Jones says, gosh, Shellie, you've done a great job. You haven't smoked for 6 months. So now we start to have discrepancies. So asking that patient, are you still smoking? Or I show that you're a smoker. Is that still accurate? How much are you smoking? And then if they say, I haven't smoked for 6 months, we can update that. Also, other things that you might be updating in the medical record, maybe a medication reconciliation. Now, that does not mean, are your meds all the same? Make sure that you ask the patient to tell you what medications they're taking. Or if they're not sure, you can say, are you taking your metformin? That's for your diabetes. Are you taking your atorvastatin? That's for your cholesterol. If the patient's uncertain about the meds or a dosage, you can contact the pharmacy and get that information. Also, you want to make sure that the patient's preferred pharmacy is up to date before the provider comes in. You want to make sure that you're updating any health maintenance screenings. Again, this should have been on your pre-visit planning from Azara or whatever program you use. And you're obviously working with the provider to set up and create protocols or screening schedule. You'll be doing your PHQs, maybe GAD-7s, maybe SBIRTs. Again, this all should come out from your pre-visit planning when you huddle with your provider on what things you need to do for each patient. History of present illness and review of systems are things that we literally just talked about with when a patient comes in and they're coughing. How long have you been coughing? Are you coughing anything up? I've got knee pain. How bad's the knee pain? all of those things. So that's kind of your HPI, review of systems, etc. Now we need to make sure that the patient's ready for the visit. So what do I mean by that? If your patient comes in and they say they've got this bruise or this knot on their thigh and they were hit by a softball, but I'm in my yoga pants, make sure that I undress from the waist down so the provider can see this knot or something on my thigh. If I have a sore throat, make sure you have out the throat swabs, cultures, etc. If a patient's there for a well visit, give them a gown and sheet and ask them to undress. Now, you can also lay the gown out and the sheet on the bed and inform Dr. Jones that he can go in or she can go in and visit first, and then they can step out. Again, a little bit of this depends on your provider preference. Diabetic patients, make sure their shoes and socks are off. So when your provider walks in the room, the provider should be ready, the patient should be ready, and the room should be ready. And then you're going to inform your patient that the provider will be in shortly. So you might just say, Johnny, Dr. Jones will be in shortly. Is there anything I can get you? When you come out, you're going to summarize that visit for Dr. Jones. Patient's here to follow up on ADHD. They said they're doing fine. Mom says she doesn't think the medicine's working because he's still getting in trouble at school or he's bouncing around at home. So summarize for the provider. In fact, if the patient's here for diabetes, but earlier, remember I said always try to see if there's anything else they need to have addressed. You can also say, patient's here in room 2 for diabetes, but she also has shoulder pain. She wants you to look at it. It's on the left side. She stated that it happened a few days ago when she was cleaning her house, etc. So when you're thinking about from the time you take the patient back until the provider goes in the room, our job is to make sure the patient's comfortable. They know who you are, the provider is, and kind of what those steps are. Your job is to know why they're here, get some of that history, make sure the chart is accurate and updated, hand off to the provider, and then keep the provider on track. So make sure you think about the flow. That means talking to your provider throughout the day. If you've got phone calls to go over with, if you're ahead of schedule, behind schedule, if somebody's running late, you want to be one step ahead of your provider all day long. Anticipate what they're going to want or what they're going to need. Make sure your provider knows where you are or who's covering for you. So if you are going to lunch or taking a break or you're going down the hall to get some supplies, make sure that there's some communication. And then, of course, your job is to take ownership of the schedule. Make sure that we're getting patients in. Double book if you need to. And if the provider says, oh gosh, I didn't know we had 2 patients, our job as clinical staff is to keep the providers calm. No worries, Dr. Jones. I've got this. Just keep moving. I'll make sure everything's ready. Everything's going to be fine. So really try to keep the provider calm, keep the patients calm, and keep the flow throughout the day. Thanks, guys. Have a great day.